Welcome to UMCC, Medical Consultant Connector, where your health matters to us. Have you ever experienced a sudden, unexpected flow of blood from your nose? This common occurrence, known medically as epistaxis, is more commonly referred to as a nosebleed. While often alarming, nosebleeds are usually harmless and tend to resolve on their own. However, frequent or heavy nosebleeds can sometimes indicate an underlying medical condition, requiring medical attention. Understanding the causes, symptoms, and treatment options for nosebleeds can help alleviate anxiety and empower individuals to manage them effectively. This essay delves into the world of epistaxis, providing a comprehensive overview to help you better understand this common ailment. From the common cold to changes in weather, various factors can trigger a nosebleed. While some causes are benign and easily addressed, others might require medical intervention. Knowing the difference can be crucial in determining the appropriate course of action. Join me as we explore the fascinating intricacies of nosebleeds, equipping you with the knowledge and tools to manage them confidently. Nosebleeds, while generally harmless, can stem from various causes ranging from environmental factors to medical conditions. Dry air is a common culprit, especially during winter when indoor heating strips moisture from the air. Trauma to the nose from a blow or fall can also lead to bleeding. In some cases, nosebleeds can indicate underlying medical conditions like high blood pressure or bleeding disorders. Certain medications, such as blood thinners, can increase the risk of nosebleeds. Recognizing the signs and symptoms of a nosebleed is crucial for prompt and effective management. While most nosebleeds are self-limiting and pose no serious threat, some may require medical attention. The most obvious sign of a nosebleed is blood flowing from one or both nostrils. The amount of bleeding can vary significantly, from a few drops to a more profuse flow. In most cases, the bleeding originates from the front of the nose, specifically the septum, the thin wall that divides the nasal cavity. Individuals experiencing a nosebleed may also feel a tingling or itching sensation in their nose prior to the onset of bleeding. This is often accompanied by a feeling of fullness or congestion in the nasal passages. In some cases, individuals may also experience a metallic taste in their mouth, particularly if they have swallowed some blood. It's important to note that while most nosebleeds are harmless, some signs warrant medical attention. If the bleeding is heavy and doesn't stop after 15 to 20 minutes of applying pressure, seek immediate medical care. Similarly, if the nosebleed is accompanied by dizziness, weakness, or shortness of breath, it could indicate a more serious underlying condition requiring prompt medical evaluation. Section 4. Diagnosis and Assessment. Finding the root cause. Diagnosing a nosebleed involves a physical exam, medical history review, and sometimes specialized tests. The goal is to determine if it's a local issue or a systemic condition. The doctor examines the nose with a speculum to identify abnormalities. They check for trauma, inflammation, or infection. Medical history provides clues about the cause. Further tests may be recommended if the cause isn't clear. Section 5. Treatment and Management. Stopping the flow. Treating a nosebleed typically involves stopping the bleeding, preventing complications, and addressing the underlying cause. Most nosebleeds can be managed effectively at home with simple first aid measures. However, severe or recurrent nosebleeds may require medical intervention. The first step in managing a nosebleed is to remain calm and reassure the individual, especially if it's a child. Panic can elevate heart rate and blood pressure, potentially worsening the bleeding. Help the individual sit upright with their head tilted slightly forward. This position helps prevent blood from draining down the throat, which can cause nausea and vomiting. Next, gently pinch the soft part of the nose just below the bony bridge, using your thumb and index finger. Apply firm and consistent pressure for 10 to 15 minutes, breathing through the mouth. This helps compress the blood vessels in the nose and promotes clot formation. While applying pressure, it's helpful to apply a cold compress to the bridge of the nose or the back of the neck. The cold temperature helps constrict blood vessels and slow down bleeding. Avoid blowing the nose for at least 30 minutes after the bleeding has stopped, as this can dislodge any blood clots that have formed. Thank you for watching. Don't forget to like, subscribe, and share for more health tips and information.